Welcome to Thrive with Pride from Age Options, an online space for LGBT older adults and those who care for them. This month, we spoke with Becky Powers from the Jesse Brown VA Medical Center. Becky shares some information about who our LGBT plus veterans are and how the VA is working to serve all who served. Be sure to see the video description below for a copy of Becky's slides and a link to learn more about LGBT services at Jesse Brown and around the VA. After you watch this video, please fill out our very brief satisfaction survey, which is linked in the video description below. I am delighted to be introducing Becky Powers. Becky Powers is a licensed clinical social worker and has been a healthcare social worker at Jesse Brown since 2012. She's been advocating for increased services for LGBT plus veterans since that time and co-founded Jesse Brown's first LGBT plus special emphasis program in 2013. She was also appointed as Jesse Brown's LGBTQ veteran care coordinator in 2016. The LGBTQ program coordinator is a new position dedicated solely to ensuring that LGBTQ plus veterans have access to the care they need. Becky works directly with veterans and providers to help develop individualized treatment plans and solve any issues that arise. She also works directly with the VISN and National LGBTQ Health Office to educate staff, network with stakeholders, and review policy to ensure that Jesse Brown is providing inclusive care to all veterans. So Becky, again, thank you so much for being with us. And when you are ready, you can take it away.
All right, thank you. And you can hear and see me okay?
Yes, I can.
Okay, perfect. All right, so thank you so much for that introduction. Like Kate said, my name is Becky. I am a licensed clinical social worker at Jesse Brown VA. I've been there since 2012. I started out working as a social worker on inpatient medicine in the hospital. And then I spent the last 7 years as the spinal cord injury program coordinator and as the inpatient acute rehab social worker. So working in the hospital setting the whole time I've been at the VA. And then more recently, I'm going to be transitioning into the full-time LGBTQ plus program coordinator role, which I'm really excited about. We're just waiting for a couple backfills for me to start that full-time. So I'm really happy to be here today. So LGBTQ plus vets, there's an estimated 1 million LGBTQ plus veterans nationwide. This is a very, very rough estimate. We don't do a good job in this country at all of keeping data on sexual orientation and gender identity when it comes to veterans. I'm pretty sure this number came from a census like a lot of years ago, and I think they counted same-sex couples living in the same household. I don't think it's very accurate. I would venture to guess that there's many, many more than 1 million LGBTQ plus vets living in our country, but that's what we have to work with. LGBTQ plus veterans are a really unique population in that they have a whole nother level of discrimination that they faced while they were in the military. And so we know that, there were outright prohibitions on LGBTQ plus people serving in the military for pretty much since the beginning of the military in this country. It was outright illegal. And then Don't Ask, Don't Tell was passed in the 90s, which in theory was supposed to make things a little bit better, but in reality kind of backfired. And, thousands of individuals were discharged dishonorably or other than honorably, specifically because of their sexual orientation or their gender identity. That was repealed. Don't Ask, Don't Tell was repealed, I think in 2011, if I remember correctly. And then in 2018, we can all remember the transgender ban that President Trump enacted in the military that has since also been repealed. And even though most of these policies and laws have been repealed, we still know that the culture of the military is one that is very kind of rigidly masculine. We can think about things even like dress codes that require really strict conformity to a gender identity. And like I said, the culture, even though the laws and policies change, I think the culture of the military takes much longer to catch up. And yet, as we know, LGBTQ plus individuals have been serving in the military since the beginning of the military. One interesting fact that the research pretty consistently shows is that the percentage of transgender individuals in the military is somewhere between 2 and 5 times higher than the civilian population. There's a lot of theories as to why this is. I don't think we know exactly, but you know, there's kind of emerging research into that, which is kind of an interesting fact. And obviously, you know, LGBTQ people are everywhere, including in the military. So it's important for us to be taking that into account at the VA when we are treating veterans. So LGBTQ plus veterans in the VA, we know that the majority of patients that we treat are over the age of 55. I personally have served primarily Vietnam era vets, Korean era vets. When I first started at the VA, I treated a lot of World War II era vets. And likewise, the most of the LGBTQ plus veterans that we treat are also over the age of 55. However, the vast majority of LGBTQ veterans don't seek care at the VA. I think there's a lot of reason for this. Anecdotally speaking, I have to assume that it's partly because the VA is often seen as kind of an extension of the military. And so, you know, going back to the culture of the military and the restrictive and discriminatory policies that most individuals served under, they're not necessarily feeling like the VA is going to be a safe place to get their health care. So the VA is trying to change that. We've recognized it as an issue from a national standpoint. The National LGBTQ Health Office exists out of VA headquarters, VA Central Office. And their role is really to do a lot of things to increase visibility of the LGBTQ plus veteran population. They do a lot of research that they publish. They are trying to improve the data collection methods that we currently have. They identify and implement best practices that they send down to VA facilities like Jesse Brown for us to implement. They have put together a ton of trainings that providers can take and that non-clinical staff can take on the provision of healthcare. Anything from complex trainings regarding like gender affirming services and how to prescribe hormone replacement therapy to just how to have a conversation about sexual orientation and gender identity. You know, trainings about like trying not to use gender pronouns when you're talking to any veteran, things like that. They also provide us with a whole bunch of resources that we can use at our facility. They have a bunch of fact sheets on LGBTQ health needs that we can share around the facility. They have inclusive imagery and signs and posters that we can put up to make the place a little bit more welcoming. And then they implemented in 2016, like Kate said, the LGBTQ plus Veteran Care Coordinator program. So every single VA in the country is supposed to have an LGBTQ plus Veteran Care Coordinator. And that person's job is really to make sure that the needs of LGBTQ vets are being met at their facility. And so that means working with vets individually to make sure that they're getting access to the care that they need. It means training providers on how to provide competent care to LGBTQ plus vets. It means reviewing policy and making sure that it's inclusive. At the vast majority of VAs in the country, the LGBTQ plus Veteran Care Coordinator program is a collateral role. And so people are doing it on top of their regular job. But it really is a good program and has, I think, improved the care for vets across the country. It links us to resources and counterparts at other VAs. We have access to the National LGBTQ Health Office directly. We work with our individual region to make sure that, you know, we're all kind of implementing standard practices. I think while we still have a ways to go, it's been a really beneficial program. So what is Jesse Brown VA doing specifically? We just got approved for a full-time LGBTQ plus program coordinator. So like I said, I'm going to be transitioning into that role once we fill a couple positions behind mine. And I'm going to be able to dedicate my entire job to making sure that we are increasing services and streamlining services for LGBTQ plus vets. That also includes resolving any issues and complaints that come my way, both from patients and providers. It means coming up with individualized treatment plans. And so a vet might call me and say, you know, I'm just moving to Chicago and I really want to work with, I want to be assigned a primary care provider who understands the needs of the LGBTQ plus community. Or they might say, you know, I want to start transitioning. How do I go about getting hormone replacement therapy? And I'll make sure that we come up with a good plan for that person. I also make sure that our facility policies are inclusive and that they're in line with national policies. And then I dedicate a lot of time to training staff, both clinical and non-clinical providers. We have an LGBTQ plus interdisciplinary work group at Jesse Brown. And so this work group, I facilitate it. It's made up of social workers, mental health providers, medical providers. We've got a dietitian, we've got a speech therapist. We meet every month and together we work as a whole team to kind of identify gaps in our programming and try to close those gaps and streamline services. One of the things that this work group did a couple of years ago was map out every single gender neutral bathroom in the facility and make a list of them for patients that might want that. And we also put that information into an app, kind of a popular app that gender nonconforming and transgender individuals often use to try to identify safe bathrooms. And then we also have the LGBTQ plus special emphasis program, which is housed under the Equal Employment Opportunity Department at Jesse Brown and is really dedicated towards the recruitment and retention of a diverse workforce. And so making sure that we're taking initiatives to recruit LGBT individuals to work at Jesse Brown VA, because it's important that the population that we treat is also represented in our workforce. So some of the services that we currently provide, we've got several groups for LGBTQ plus vets. We've got the Band of Colors group, which is kind of a general group for LGBTQ plus vets that's run by one of our social workers. We also have the I Am group, which is run by one of our psychologists and is for our gender diverse, transgender, and gender nonconforming veterans. We're just getting up and running with the Pride in All Who Served group, which is a national pilot, and it's an LGBTQ plus focused health group. And so the goal is really, the topics are things like, you know, advocating for your healthcare with your provider, coming out to your provider, information about PrEP and how to get it through the VA, things like that. So that's just getting up and running. And then our speech therapist who does gender affirming voice therapy is starting a conversation group in August. And so this is for gender nonconforming and transgender vets who have been doing gender affirming voice training. It's a chance for them to get together as a group and kind of practice the skills that they've learned together in a safe space. We have identified a handful of mental health providers at our facility and at our outpatient clinics that have dedicated time and resources to ensuring that they're properly trained to meet the needs of LGBTQ plus vets and what their kind of unique needs are. And so when I have a vet that calls me and says, you know, I want to be assigned to a mental health provider that understands my community, we have a handful of people that we can assign them to. I am working currently on also identifying a group of primary care providers that have also been trained in LGBTQ plus health needs that we can assign patients to as well. And then we also have an LGBTQ plus coordinator at the VA Benefits Administration, which is technically a separate agency from the Veterans Health Administration. And so this person can help with accessing benefits. One of the really important things that she does, though, is she helps veterans who were dishonorably discharged because of their sexual orientation or their gender identity. She helps them appeal that discharge. And that's really important to us because if you weren't honorably discharged, you can't access VA healthcare services. And so there's thousands of vets across the country that were discharged dishonorably and don't have access to VA healthcare. And so we've got someone in Chicago right across the parking lot from us that can help those vets appeal that discharge so that they have access to the care that they need. We also have all kinds of gender affirming services. At the moment, we provide essentially everything other than gender affirming surgeries. The VA nationally is taking steps to start providing gender affirming surgeries, hopefully within the next year. It's a very bureaucratic process that I'm not involved in, but I'm really excited about it. At the moment, we do everything else. And so at Jessie Brown, we do any diagnostic evaluations you might need, gender dysphoria evaluations, readiness evaluations for hormone replacement therapy, readiness evaluations if you're getting surgery outside of the VA. We'll do letters of support if you're working with a surgeon outside of the VA. Vets do have the option now to update their chosen name and their self-identified gender identity in the health record. And soon they will also be able to update their pronouns and sexual orientation. This is not specific to Jessie Brown and not something we have control over, but nationally has really contributed to the fact that we don't really know who we're treating because we don't have any data available. And so implementing these things is going to go a really long way to learning more about who we're actually serving and how to implement programming based on their needs. We do all sex-specific preventive care, so pap smears, prostate exams, regardless of gender identity. We do hormone replacement therapy at Jessie Brown. Like I said, we have a dedicated speech therapist that is trained in doing gender affirming voice therapy. She works individually with vets to kind of train their voice to be more in line with their gender identity. We do laser hair removal. We'll get any prosthetics items you might need. So anything from chest binders to gaffs, stand to pee devices, breast forms, free of cost. And then even though we don't do surgery right now, we do all pre and post-op care. So any labs you might need before your gender affirming surgery, anything you need after surgery, we do all of that. For LGBTQ plus older veterans, I think they're kind of a much more unique population in that they definitely served under either Don't Ask, Don't Tell or one of the more prohibitive policies. And so it's really important, especially given the average age of the people that we treat, that we're being mindful of that. And so we have implemented non-discrimination policies in the hospital and with all of our contracted nursing homes. And so it's stated specifically that we don't discriminate based on sexual orientation, gender identity, also race, etc. And that includes who's visiting you in the hospital. So we're not going to prohibit visitors based on sexual orientation. Anyone that you trust or care about can come visit you if you're admitted to the hospital or in a nursing home. Our advanced directives and our advanced care planning is the same thing. You have the ability to designate anybody that you trust to make your medical decisions on your behalf if you can't make them yourself. We don't make you choose somebody you're legally married to. We do ensure, like I have a specific conversation with the vets that I work with. You know, if you don't have an advance directive, this is how Illinois surrogacy law works. We would first have to look for a legal spouse. If you've been with your partner for decades and decades, but never got legally married, they're not legally going to take priority. And so it's important that our vets understand and know how the law works and implementing those advance directives if they want to. And then we do a lot of trainings at Jessie Brown on the more unique needs of LGBTQ plus older vets. And so we've done some of the trainings that Howard Brown offers for our nursing staff on the provision of care for LGBTQ plus aging vets. We just last month had a social work presentation for continuing education on LGBTQ plus aging. And then I do kind of more department specific trainings. So, you know, for example, I did a training with our inpatient social work staff in the hospital on, you know, this is the importance of trying to find LGBTQ plus friendly nursing homes when you need to do placement with a vet. The importance of like talking with them about the referral process and being really mindful about not outing them during the referral process when you're sending their records over to a nursing home. So, you know, I think that we have a ways to go yet. Like I said, culture change takes a long time, but I think we're really taking steps to make the VA a safer and better place for LGBTQ vets to get their care. And that is all I have. This is my direct phone number and my email. If people have questions or, you know, comments, things come up, you can always feel free to reach out directly to me.
Thanks again to Becky Powers for a great presentation and for a particularly lively discussion afterwards, which we did not record. Again, please see the video description below for a copy of Becky's slides and more information. Please also help us by filling out the brief survey that you'll find there. You're invited to join us for our next monthly event on Tuesday, August 23rd at 11 a.m., when we will hear from Kim Hunt of Pride Action Tank about the tank's efforts to create a more just and inclusive world for LGBT older adults. Kim will share Pride Action Tank's work on the forefront of many advocacy issues, including long-term care and affirming aging services. Login information is posted below and available on our website at www.thrivingwithpride.org. Thanks for watching. We hope you'll join us next month.